Good morning. Welcome to the regular Wednesday briefing. I'm Karen Smith. I'm filling in for Maya Carroll as she has a much deserved week off. As you can see, we were going to start with Dr. Moreno, but I don't see him here yet. So we'll give him just a minute, just in case. And then we'll move on. Well, thank you for your patience. I'm going to move directly to Dr. Harris and let him talk about and have him talk about this exciting news at yesterday's board meeting about integrating the hospital along with the county clinics and what that will mean. It's a heavy lift. There's lots to do, but why that is really a critical move towards making our county healthy. Welcome, Dr. Harris.
Thank you, Karen, for that introduction. And yeah, I would share in that. We're very excited, and we're happy to announce the Board of Supervisors yesterday supported myself and Elsa Jimenez, the Director of Health and our CAO, with our vision for an integrated health system, which ultimately is about propelling us and providing excellent care for our patients and really for our community well into the future. And just to review, our vision is to create a patient-centered, unified, sustainable Monterey County health system committed to improving the health of the entire community and with emphasis on the vulnerable. Key elements of the direction that the Board of Supervisors provided to us were that they directed the Director of Health, the CEO, myself, and the County Administrative Officer to work in partnership to build this integrated health system. As well as the second key item was they created an ad hoc committee to provide guidance to this process. The supervisors that were appointed were Supervisor Lopez as well as Supervisor Root Askew, who have been very involved with the health system and for a number of years. I think folks know that Supervisor Lopez is also on our Board of Trustees. And then the third directive was for the formation of an internal leadership group called the Monterey County Unified Planning Committee to report regularly to the ad hoc committee of the Board of Supervisors. Noting the MCUP consists of the Health Department Director, the CAO, and the Natividad CEO, as well as the Assistant CAO. The MCUP will organize the necessary approach, oversee prioritization of initial work areas, and potentially serve as a precursor entity to the integrated health system. And I'm happy to answer questions, and I believe Elsa will be joining it soon as well.
So if you have questions for Dr. Harris, please put them into chat. I'll give you a little bit of time to formulate your question. Oh, come on. This is a very exciting move. I know it's been long in coming, and it is quite the lift, as they say. We're moving along. I think you're going to get off with no questions. Thank you, Dr. Harris.
Of course.
And I see Dr. Moreno has joined us. So Dr. Moreno, do you have any updates for us this week?
Hi, Karen. Good afternoon. No updates, no reports, but happy to take questions regarding the COVID pandemic.
Okay, I'll give people time to put in some questions. Oh, okay, so here's the first question. The Neurovax COVID-19 vaccine has been approved and is said to be a more traditional vaccine. What makes it different from the Pfizer and Moderna vaccines?
Thanks, Karen. That's a good question. So the Pfizer and Moderna vaccines are based on a technology that utilizes RNA, which is nucleic acid, that looks very similar to the RNA found in the original COVID variant. And that when someone's immunized, causes the individual to produce fragments that stimulate their immune system to generate an antibody response and impart some immunity to COVID if they were to get exposed. This new vaccine was just authorized by the FDA. It's a different technology, doesn't rely on RNA material. It relies more on proteins that look like the actual proteins in the virus, but it's not the virus. It's not a live virus. It's just mostly just these particles that look a lot like parts of the virus. And so that in combination with another called an adjuvant, which really kind of like stimulates the immune system, that combination causes the person who's immunized to develop antibodies that can impart some protection should that person be exposed. So different technology. That technology has been around, has not just been around for a long time, but been used in other vaccines that have been administered for quite some time. So it's familiar technology that's being used to protect people against COVID-19.
All right, any other questions? Oh.
And Karen, I'll just
Yes.
add that I believe that there are some people who, when asked why they're not going to get vaccinated with one of the previous vaccines, they may have stated that they are hesitant due to the nature of the RNA technology used in those vaccines. So for any of those people who really were concerned about RNA vaccines that have been authorized by FDA, this is a different technology, and they may want to look into this and reconsider getting vaccinated with this vaccine. And it's a 2-shot series.
All right, thank you. And then the follow-up question to that is, has the health department received any doses of the Neurovax vaccine? And then how much? And then if we have, when will it be available?
Thanks, Karen. So no, it's just been authorized this week, and we don't, county at this point doesn't have any, and I don't believe we've been notified as to what an allocation might look like.
Okay, any other questions out there? We'll give you some time. All right.
All right.
I have a quick question just to add.
Yes, Karen.
It's Rodeo Week. I'm sorry, I'm not from here. It's Rodeo Week. Do you have advice to people to stay healthy while they're enjoying the events?
Yeah. So yeah, thanks for the reminder. The rodeo is considered a large public gathering, and the current recommendation from public health is to test before travel and before attending large events. And I would consider the rodeo a large event, and also recommend testing 3 to 5 days after traveling, or 3 to 5 days after attending a large event like the rodeo. So those who are attending could consider testing before and testing afterwards, because there could be an increased risk of exposure when attending the rodeo. And then continue to take the other precautions to prevent illness in the first place, which would be getting vaccinated, getting boosted if you're eligible. Also, wearing face coverings if you're in the indoor settings at the rodeo. Consider wearing a face covering, especially if you know you're immune compromised or at high risk of getting severely ill if you get COVID. And certainly, if a person is planning on going to the rodeo and they develop symptoms of COVID, they should not attend the rodeo.
All right, thank you very much. And I don't have any other questions, so I can let you go. All right, thank you.
Thanks.
All right, next, we have Michelle House from the tobacco program. And she's going to just give us an update on tobacco retail licensing.
Hi, thank you, Karen. Yes, a recent update. So last week at the Board of Supervisors, we did a presentation that really showed a change in the enforcement piece. So as you know, many months ago, we passed for the county a flavor and single-use e-cigarette ban, and that got a lot of press. And in the meantime, since that ordinance had been passed, or we should say the amendment of our existing tobacco retail licensing ordinance, we've done a little bit of change. So historically, the enforcement piece, when we think of enforcement and we think of what some people call stings or young adult tobacco purchase surveys, those had historically been done by our Monterey County Sheriff's Department. And that, as of July 1st, that particular piece of enforcement has now been handed over and is going to be utilizing we're going to utilize the same exact kind of skills and young people, the exact same way the sheriff had been doing it. We're going to do that now within the Environmental Health Bureau. So the Environmental Health Bureau has also been doing a type of enforcement, but not that piece. They had, while the sheriff would do their young adult tobacco purchase surveys, the Environmental Health Bureau would visit all of the tobacco retailers and ensure that they are following the letters of the law with regards to federal, state, and local licensing. For example, is license might be, is your license up on the wall? Are there single tobacco pieces for sale on the counter, which is illegal? Is all of my tobacco locked up? So now they will take on that piece that they have done historically and now added to their workload is going to be the youth tobacco purchase survey. So they will be primarily all things tobacco now for our county. And then the public health piece, which I am the supervisor over, will continue to be what I have been saying, the soft gushy piece. So we're the educators, we're the ones that go out to the retailers to onboard them when a new tobacco retail licensing ordinance is passed within their city. We go out and do kind of a welcome packet and welcome to the family and let them know what is allowed and not allowed and do that real formal education piece. And then down the road, if there's ever an issue with the retailer, we will once again visit and be part of the active enforcement that is happening with our Environmental Health Bureau. So that is a big change for us, but we're looking forward to the shift. And I know that environmental health will be able to step up to the plate and do great work.
It helps if you unmute. If you have questions for Michelle, please put them in the chat. I have a question. How would somebody, if you've got a team that would like to, I guess, serve as a decoy or become part of it, how would they sign up to do that?
Oh, that's a great question. Oh, yes. Yes, we're taking all teens, right? So we're looking primarily for 18-year-olds, but that doesn't mean that the Environmental Health Bureau would, I think, turn a young person away. So I recommend that they could start with me because I'm not exactly sure. I would want to say a name, but I don't want to say that name publicly and then go, no, Michelle, that wasn't the right person. So let's have them contact me, Michelle House at the health department. And that way I will make sure that the person that's coming to my mind as the contact is correct. And then I can do a soft handoff. So any young person, and remember in this, in the state and in the federal system of tobacco, anyone under the age of 21 may not purchase tobacco. So of course, a 16-year-old is also part of a decoy, but even an 18, 19-year-old can be part of a decoy because if you're 19, no one should be selling to you. So we're looking for a variety of ages to be able to do this work.
I don't see any other questions. I'll give somebody a little bit more time. Nothing. Okay, it does. So I'm going to open it back up to any other questions from our previous. And it looks like we don't have any. I'd just like to remind everyone that tonight is the virtual town hall talking about 988, which was discussed on the media briefing last week, for which is the new suicide and crisis helpline for nationwide. So that's at 5:30, and you can find information about that on our website, on the health department website at www.mtyhd.org, and we'll be happy to see you then. So thank you all for coming, and we'll see you next week.